Shock loss in the donor area after FUT. Hi, I'm 20 days post-op, FUT 1200 grafts. I'm on Propecia and I see hair loss in the scar area. I think the scar is healing good. Is there something else I can do, maybe use Rogaine to prevent further hair loss? And will this hair come back? Thank you.
Thank you for your question. You've submitted a photo showing the area where you've had the hair transplant harvested from with a question stating that you're 20 days after having follicular unit transplant or FUT or strip surgery for hair transplant, 1200 grafts, you're on Propecia, and that you are noticing some what you describe as shock loss in this area. And you want to know if there's anything that can be done to help this area regrow the hair. Well, I can certainly give you my perspectives on this situation. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Hair transplant has been a significant part of my practice, and in fact, I'm the founder of TrichoStem Hair Regeneration Centers, a system of non-surgical solutions for hair loss using acellular matrix and platelet-rich plasma. Essentially, for men and women with thinning hair, we have developed a process that can regrow hair, thicken hair, and actually work as an alternative to surgical hair transplantation. And this system was derived from doing hair transplant. So to begin with, just to give you an overview of what you're going through and the journey ahead, and I'm sure your transplant surgeon discussed this with you. You have to understand that when you harvest from this area in the back of the scalp, basically the goal is to take out as many hairs as you can in order to transplant to get the best coverage in the areas where you had hair transplanted. But for the surgeon, there is a balance that has to be achieved. And what's that balance? The balance is to minimize the degree of tension on that incision so that it closes very well, so that the scar heals well. And for the future, to close it in a way so that there's minimal tension, so there isn't permanent loss of hair. So it's a balancing act. And so when we talk about numbers of grafts and then the length of the strip of hair and the width, that's basically the global intention. And sometimes colleagues have been very, very aggressive, myself included, where a patient needs a lot of hair and you try to push the limits. Now, I'm not saying that that's what happened here, but that's just to understand what the concept is of doing a strip surgery, which has been the gold standard for many years. Now, in our practice, to help facilitate the healing of this area, as well as to deal with problems such as what you're experiencing, like shock loss, we started using a material called acellular matrix, which is a material derived from pig bladder to help stimulate the stem cell activity to facilitate healing. Now, this doesn't mean that you absolutely have to use this, but this is what we just described, what we did in our practice to help ensure maximum healing. Now, that being said, this is an area which it has a long time ahead to heal, and chances are that hairs that are lost from shock loss, which is referred to as telogen effluvium scientifically, where hair in a given area may temporarily shed, but the roots remain, and then the hair regrows, but it grows back in 3 to 4 months typically. With hair transplant, there are a lot of phases you're going to be going through, and understand that really the final result takes about a year, and in some people it takes even longer. So this is an evolution and process. So as far as the possibility of facilitating regrowth, If someone comes to me and says to me, okay, I'm 20 days out from a hair transplant and I want to facilitate regrowth, I would probably say that there's some potential value and at least no harm in just applying a little bit of topical minoxidil, although it's unlikely that it'll make an impact, but there may be really no harm in doing that. As far as other options, such as platelet-rich plasma injection, platelet-rich plasma with acellular matrix, I think there's probably some potential value, but I would caution you, because I think that this is an area that's already relatively well covered. If you grow your hair long enough, it'll just flap over. So in patients who come to us who have had hair transplant done elsewhere and they want to maximize their yield, we do hair regeneration injection treatment, which is a combination of acellular matrix and platelet-rich plasma, which I developed over several years. And what I do is I'll inject in the area where they've had the grafts placed. And generally speaking, if we do it within the first 3 months or so, there is certain types of value that can be derived from that benefit in the area of the grafts. I can't say that we've really had much call for treating the donor area, so I can't say specifically that, well, we've treated this many donor areas and they healed that much better. I think it's kind of a tricky thing to really establish what would have been natural healing, what would have been healing with some type of stem cell-based technology. I would also say that if this was your first hair transplant, this is probably going to be the best yield, as well as the area the skin will have the least tension. So I think it's all right to just leave it alone and just let it grow. There is always time to do some kind of potential scar revision, or if you undergo a second transplant, to revise the area. But as far as shock hair loss is concerned, I think you have 3 to 4 months just to allow regrowth, and chances are you may not even realize that there's been regrowth, and before you know it, it's going to be as good as it can be. But again, you're looking at a wound healing process that's going to be months to about a year. So pace yourself is probably the take-home message. It is natural to examine areas which have been treated, but to really look at everything so critically probably will be more exhausting than fruitful. It's appropriate to ask these questions, but I think you should seek the guidance of your operating surgeon as to what to do, because no one's going to know this area better than the doctor who did the surgery. And that, I think, is also an important thing to understand, is that anyone who gets a second look can certainly give you their perspective from their clinical experience, but the doctor who performs the surgery is naturally going to do the best job they can to get the best results they can from their clinical experience. So again, to summarize, likely from just this one photo and this question, I would say doing nothing will likely result in just whatever hair that should grow will grow. Allow a year for the full expression of the transplanted hair, as well as the full maturation of the donor area. And of course, continuously follow up with your doctor to get a sense of how you're progressing, and if there's any intervention that your doctor feels would be useful for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.